In every corner of our country, from the bustling cities to the remotest tribal hamlets, there is a quiet strength that sustained families, communities, and the nation itself, the strength of women. Yet, for too long, this strength has been tested by challenges of poor healthcare access, malnutrition, preventable diseases, and silence around women's health. Today, a new chapter unfolds, a chapter of hope, dignity, and empowerment. A chapter titled Swasth Nari Sashakt Parivar Abhiyaan, an initiative that places women and families at the very heart of India's development journey. So hello and welcome. You're watching Next IAS English. Today let's talk about a new Abhiyaan that has been launched on the 75th birthday of Prime Minister Narendra Modi. This Abhiyaan is more than a campaign. It is a Jan Bhagidaari movement, a collective effort that calls upon government, private hospitals, healthcare professionals and every citizen to join hands. With over 1 lakh health camps being organized at Ayushman Arogya Mandirs, community health centers and Anganwadis, this is the largest ever health outreach for women and children in India's history. इस इनिशिएटिव की एकेडमिक फाउंडेशन कई दशकों के नेशनल हेल्थ सर्वेस पर बेस्ड है, जिनमें persistent gaps सामने आए. Women में anaemia, high maternal mortality, preventable child deaths और cancers का late detection. स्वस्थ नारी सशक्त परिवार अभियान SNSPA इस कंसर्न को डायरेक्टली एड्रेस करता है, एक साइंटिफिक, कम्प्रिहेंसिव और इंक्लूसिव अप्रोच के थ्रू. From anemia to hypertension to diabetes, tuberculosis, reproductive health and cancers, screenings will ensure that every woman has access to early diagnosis and timely care. For tribal communities, special counseling will address sickle cell disease and tuberculosis, conditions disproportionately affecting these regions. पर हेल्थ सिर्फ डिजीजेस का ट्रीटमेंट करने के बारे में नहीं है, ये जिंदगी को नर्चर करने के बारे में भी है. इसीलिए ये अभियान मैटरनल और चाइल्ड केयर को मजबूत बनाता है. एंटीनेटल चेकअप्स, काउंसलिंग और मदर एंड चाइल्ड प्रोटेक्शन कार्ड्स के थ्रू विमेन सिर्फ केयर ही नहीं पाएंगी, बल्कि अपने मदरहुड की जर्नी को ट्रैक करने का कॉन्फिडेंस भी गेन करेंगी. इम्यूनाइजेशन सर्विसेज अंडर मिशन इंद्रधनुष, न्यूट्रिशन सपोर्ट थ्रू पोषण 2.0 एंड बेनिफिट्स फ्रॉम प्रधानमंत्री मातृ वंदना योजना ensure that no mother and no child is left behind. Every life saved, every mother cared for. It is a step towards lowering maternal and child mortality rates and towards building stronger families, the foundation of a stronger India. There are battles that medicines alone cannot fight. Battles against stigma, silence and misinformation. The Abhiyaan drives behavioural change through education, workshop on menstrual hygiene, nutrition and wellness by breaking taboos and opening conversations. It gives women knowledge, dignity and the power to make informed health choices. In these small but profound changes, we find the seeds of a healthier, more equitable society. At the heart of this mission is community participation. The campaign thrives on the spirit of Jan Bhagidaari. Citizens, volunteers and organizations like the Indian Red Cross Society stepping forward. निक्षय मित्रास जो पहले से ही ट्यूबरक्लोसिस पेशेंट्स को सपोर्ट करते आए हैं, यहाँ भी क्रिटिकल पार्टनर्स हैं. ये सॉलिडारिटी की स्पिरिट एम्बॉडी करते हैं, दिखाते हैं कि हेल्थ केयर चैरिटी नहीं बल्कि एक शेयर्ड रिस्पॉन्सिबिलिटी है. कोलैबोरेशन, कंपैशन एंड वॉलंटियरिज्म के थ्रू ये अभियान सिर्फ एक गवर्नमेंट प्रोग्राम नहीं बल्कि एक पीपल्स मूवमेंट बन जाता है. Efficiency and transparency are essential for this impact. The Abhiyaan introduces real-time monitoring through the Sashakt portal. Every health camp, every screening, every immunization will be tracked digitally, ensuring accountability, proper resource allocation and timely intervention also. Healthcare workers from ashas to medical officers are empowered to self-verify their work, strengthening grassroots governance. This integration of technology with community action is a hallmark of India's health policy evolution in the 21st century. The expected outcomes are ambitious but achievable. Improved health metrics, reduced maternal mortality and increased awareness of hygiene and wellness. Expanded access to healthcare in rural and tribal regions. with specialists reaching underserved areas. By embedding health education into community life, SNSPA promotes sustainable behavioral change, ensuring that progress is not temporary but transformative. The Swasth Nari Sashakt Parivar Abhiyaan does not stand alone. It builds on the legacy of visionary programs like Swachh Bharat brought dignity through sanitization, Mission Shakti strengthened women's safety and empowerment, Poshan 2.0 tackled malnutrition head-on. Now, SNSPA unites these threads, weaving health, empowerment and family well-being into one integrated mission, aligned with the Prime Minister's vision of Viksit Bharat 2047. This is more than a campaign. It is a promise that no woman will suffer in silence, that no child will be denied a healthy start, that no family will be left behind. It is a movement that honors the resilience of women, celebrates the strength of families and builds the foundation for a healthier, stronger and more empowered India. Swasth Nari Sashakt Parivar Viksit Bharat. Together we rise, together we heal, together we build the future. And that's it for today. I will see you in another deep dive video. Until then, bye-bye. Take care.